Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Fallopian tubes are two slender tubes, one on either side of the uterus. Their job is simple but very critical: to capture the egg released by the ovary, provide a space for fertilization of the sperm, and transport the fertilized embryo into the uterus. If these tubes are blocked, damaged, or non-functional, the egg and the sperm can't meet and natural pregnancy cannot occur. But we have to understand what causes tubal blockage. To begin with, there are several reasons why tubes can be blocked or damaged, and pelvic infections should be talked about first. The most common cause are infections like chlamydia and gonorrhea, which can silently damage these tubes without obvious symptoms. Repeated infections can cause scarring and adhesions. Next, genital tuberculosis. In India and other developing countries, TB is a leading cause of tubal blockage. Often it goes undiagnosed, affecting the tubes and the uterus. Endometriosis is also one of the reasons. In this condition, tissue similar to the uterine lining grows outside the uterus, including on the tubes or inside the tubes. This causes inflammation, scarring, and distortion of pelvic anatomy. Previous surgeries can also cause tubal blockage. Operations like appendectomy, C-section, or fibroid removal can cause pelvic adhesions that block the tubes. If you have a history of ectopic pregnancy also, your tubes can be severely damaged. Sometimes the tube may need to be removed entirely. Then we have congenital abnormalities, which are very rare, and some women may be born with malformed or absent tubes, and these can cause tubal blockages. How does it affect infertility? The answer is very simple. They block the path. Sperms travel from the vagina through the cervix and uterus into the fallopian tube. The egg is released from the ovary and picked up by finger-like fimbriae at the end of the tube. Fertilization happens in the tube, and if the tube is blocked, fertilization can't occur. Or if it does occur, the embryo can't reach the uterus, which may lead to ectopic pregnancy, which is a life-threatening condition. There are several methods to diagnose a blocked tube. Hysterosalpingogram is one, where an X-ray test is performed. Dye is injected into the uterus to check if it flows through the tubes. It's a very simple outpatient and usually done between day 6 to day 11 of the cycle, and can give us very good information about the tubal blockage. Sonosalpingography is also another method. It uses saline and ultrasound instead of dye and X-ray. Less painful and no radiation. Laparoscopy is also one of the procedures where a minor surgery with a telescope is inserted into the abdomen. It is a gold standard. We can see the tubes, look for endometriosis, adhesions, and try to open minor blocks during the procedure. Treatment depends on the type and severity of the blockage. Mild block or near the uterus, which is called as the cornual block, may be treated with tubal cannulation, where a guide wire is used to open the blockage under hysteroscopic guidance. Hysterosalpinx or fluid-filled swollen tubes, if are present, they are caused by chronic infections. This toxic fluid can actually reduce IVF success. Recommended treatment is salpingectomy, where the tube is removed surgically before IVF. Tubal surgery is also a method. It's performed only in selective cases. Tubal reconstruction can be attempted. Success depends on the location and the extent of damage. However, risks of ectopic pregnancy remain high. IVF is also one of the options where women with bilateral tubal blockage can go through it, bypass the tubes entirely, eggs are retrieved, fertilized in the laboratory, and the embryos are transferred back into the uterus. If you wish to understand more about this, please feel free to contact us. Thank you.